Our today's topic is rational use of medicines. Rational use means prescribing the right drug in adequate dose for a sufficient time period and appropriate to clinical needs of the patient at lowest or inexpensive way in an inexpensive way. The next is definition of rational use of medicine. It means the right patient, right medicine, correct dose and duration at reasonable cost. According to WHO, the rational use of medicine require that the patient receive medications appropriate to their clinical needs in dose that meet their own requirement for an adequate period of time and at a lowest cost to them and their community. Means right patient, right medicine, correct dose according to the disease of the patient at a reasonable cost. Next is criteria for rational use of medicine. First is correct diagnosis. It is very important to diagnose correctly. Properly, doctor can properly identify before prescribing any medicine that the patient have a disease. Second is appropriate medicine. You can select the medicine based upon the efficacy, safety, bioavailability of that drug. Third is right indication. Medicine prescribed only when it is genuinely needed by the patient based upon the clinical test. Test tells us about the disease of the patient. Next is correct dose and route. Right dose, formulation, route of administration are equally important in the treatment of a particular disease. Adequate duration, not too short and not too long. It should be for the right duration of time period. Next is cost effective. We can select the dose or drug with maximum therapeutic effectiveness at low cost. It can be affordable to all. Along with this, some other factors like it should be correctly dispensed by the prescriber or dispensed by the pharmacist. It appropriate patient counseling should be there, and the most importantly, patient adherence is also important. Next is irrational use of medicine. Irrational use of medicine is a major problem worldwide. WHO estimate that more than half of the medicines are prescribed, dispensed, or sold inappropriately by the prescriber or by the any medical staff, and that half of the patient fail to take them correctly. A patient, and there is a mistake from the patient side also, that they are not, fail to take them correctly. The overdose, underuse, misuse, overuse of the medicine resulting in the wastage of resources and widespread health hazards. There are health hazards if we use the drug in appropriate manner. Then there are some examples of irrational use of medicines like polypharmacy, use of too many medicines daily per patient. There are 5, 6, 7 doses are there. Overuse of antibiotic only given for the microbial infections and also for the limited time period, not for too long. Overuse of injections when there are oral formulation, it would be more appropriate oral formulation than there is no use of injections. Failure to prescribe the drugs in accordance with clinical guidelines, not prescribing as per standard treatment guidelines. Standard treatment guidelines are there. Prescribers should be prescribed the drugs in accordance with standard treatment guidelines. Underdosing or overdosing, it will lead to treatment failure or toxicity. Next is unnecessary prescribing. Sometimes doctor unnecessarily prescribing the drugs. It include unnecessary use of expensive medicines without proper clinical indication. Last is self medication. Self medication, some people use over the counter drugs without prescription. It can lead to toxicity in the body due to overdose of the drug or for longer duration of period. Other factors for irrational use of medicines are unnecessary combinations are there, incorrect duration, unsafe use of corticosteroids, and from the patient side, non adherence to the dose and duration. Next point in this is, what are the reasons for irrational use of medicines? There are basically two types of reasons. One from the prescriber related, second is from the patient side. है ना? First is prescriber related, that is prescriber don't have any training. In the lack of training, knowledge, lack of information to the prescriber about the drug or disease, patient load to a particular doctor. There are too many patients in one OPD. Lack of diagnostic facilities. You cannot diagnose the disease and you prescribing the drugs to the patient. Promotional activities of pharma industries also reason for irrational use of medicine. Defective drug supply system and ineffective drug regulation. There is no regulation in many part of the world related to drugs. It is one of the reason for irrational use of medicine. Second is from the patient side. There are self medication without any advice, without any prescription, non adherence to the dose or duration of the uh, drug, demand from the patient for injections and antibiotics. And there is no need of antibiotic, but patient demanding itself that some injections or antibiotics are needed or not. There is one more cultural belief and practices are also reason for irrational use of medicine. Next is intervention strategies to promote the more rational use of medicine. It is very important to use rationally drugs. WHO, World Health Organization, give 12 keys for intervention of rational use of medicine. Some are educational, some are managerial, some are regulatory, and some are economic. First is educational intervention. It give a proper training. First point is to give proper training to the medical staff. There should be some continuing medical educational program to the medical professionals, continuing in service medical education as a licensure requirement. Public awareness campaigns to tell the self medication risk and toxicity caused by the overdose of the drug. Second point is managerial intervention. Essential medical list is there, medicines list is there. You can prescribe the drug accordingly. It should be implemented to follow the standard treatment guidelines. There are some guidelines for the treatment of a particular disease. It should be followed by all the medical staff at all the levels. There should be some audits to in the hospital, and to also it also consider the reviews from the patient after the utilization of drug, after the treatment of a particular disease. Third is a regulatory intervention. First is to restrict the over the counter drug. Without prescription, there will be no drug given to any patient. Drug registration, it is an important factor, and also for the sale of drug there should be licensed premises and licensed authority is there, licensed person is there, competent person is there on the shop or on the pharmacy. All the medical staff or all the pharmacy staff follow the regularization or regulations from the PCI or any medical council. Economic interventions are there. Drugs should be affordable to all. It can be maximum retail price should be fixed from the government. Reimbursement in some cases should be there, and no incentive to the prescriber in case of any drug, and you can sell the too many drugs and you will get the incentive. This practice should be avoided. Next is steps for rational use of medicine. How can what steps to be taken for rational use of medicines? There are 6 steps. First is define the patient problem. Firstly, you can identify the problem or identify the disease based upon the symptoms, based upon the history, examination, and then recognize the need for the action. Second is to specify the therapeutic objective. You can clear the goal about the cure, prevention, or treatment. What type of treatment a patient, according to his symptom, history, examination, needed. Third is select the appropriate treatment. Choose the effective, safe, less expensive treatment for the patient. Fourth is to start the treatment. How can you start the treatment? Give the treatment by writing an accurate and complete prescription. It is from the prescriber or a doctor, like name of the drug with doses form, dose schedule, and total duration of the treatment and total dose. Next is give information and instructions. Give proper information and instruction to the patient, warning to the patient regarding the treatment like adverse drug reaction, risk of stopping the therapy suddenly, and risk of overdosing, risk of less dosing. Give all the instructions to the patient. Sixth is to monitor and stop treatment. When you stop the treatment, it is also it is also an information given to the patient. Monitor the treatment to check if the particular treatment has solved the patient problem. Then there are 2 types of monitoring. First is passive and second is active. Passive, it is done by the patient himself. Explain him what to do if the patient is not effective, if the treatment is not effective, and if too many side effects occur, then patient himself stop the treatment. That is known as passive monitoring. Second is the active monitoring. It is done by the physician and he make an appointment to check the response of the treatment. Then active monitoring, physician is check the patient and stop the treatment. This is all about the rational and irrational use of the medicines. Thank you.